Hello, Green Spring. Today is Thursday, July 12th, 2018. I'm Fran Duvall, the host for today, and I'm very pleased to meet this lady for the first time, Christine VandenDries. And Christine, good morning.
Good morning.
And Christine is the home care administrator.
Yes.
And you know, earlier out there in the control room, we were discussing the phrase home care because it seemed almost new to us because we usually talk about home health or home support as the two fields. But this home care represents both of them, you're telling me. Is that correct?
It does. They have sort of done some re-engineering of the management positions within the home health and home support offices. There used to be separate managers over each line of business and clinical managers to manage the clinical operations of both. Now they've taken away the separate managers and brought both lines of business under one home care administrator. And that would be me.
And that's you. Okay, and you told me you've been here 5 weeks?
I think today is 5 weeks, actually, yes. I believe
My
so.
goodness. You're brand new.
I am. Yep.
Where'd you come from? What'd you do before?
I have been a nurse since 2003, and I was living in Georgia prior to this. I actually grew up in Springfield, moved away, and then came back about 6 weeks ago. I was working as a clinical manager for a large home health company down in like the suburbs of Savannah. And but we were all community based. It wasn't, you know, like this where you guys have everything you need on site. This was 8 counties and 2 hours from the furthest patients, you know, in between. So it was a very different sort of type of care. So.
And you haven't worked at Green Spring before, though?
I have not.
Before you left here?
No, I used to work at Virginia Hospital Center and for a home health company in the area that doesn't exist anymore.
Okay, all right. Well, we exist for sure.
Yes, you do, and thriving at that.
How are things going? I mean, like, are you all able to supply all the requests you have for help, or are you in need of help, or what?
On the home health side right now, we're kind of teetering on that edge of we're probably going to have to start getting some more staff. You know, we're growing, our numbers are growing, which is wonderful. We have incredible staff that has chipped in full-time, and some of our on-call staff, they're all very, very busy and pretty much working every week, where sometimes, you know, the on-call staff might have weeks where they're off. They've really been working a lot. So we've got some open positions for home health, and then for home support, we're always in need of our companion workers, our CNAs. I believe we just hired another nurse on the home support side as well. So we're the home support hours of service are growing very quickly. So people are choosing Green Spring home support and then recommending it to their friends, which is wonderful.
I did likewise when I used both
Great.
when I had an injury, and you know,
that's wonderful.
Went from the health part to the support part. Yeah, and I've actually now doesn't the support side, like, I mean, I need my closet organized. I mean, don't they do things like that too?
They can. The home support staff has different types of caregivers that are available. So some of them are CNAs, some of them are companion workers that can help around the house with non-clinical, non-personal care tasks. We have some that even help, you know, take, you know, a dog for a walk if someone is unable to do so, not home, whatever. They have a wide variety of things that they can do to help out in home support.
And that's the group that you may, that are always in need of more staff.
Yes, we are always, our numbers are growing, and we're always in need of more companion workers, CNAs, those sorts of things.
Look, we're all getting older here. I've been here 15 years, so
that's awesome.
See, when you come to Green Spring, you live longer. So the longer you live, the more care you're going to need as time goes on. So
that's absolutely right. And one of the things that in my own personal life I'm going through is I have a grandmother who is 86, and we are kind of on that edge of, is she going to stay at home with her family, or is she going to go to an independent living or an assisted living? And, you know, we've really tried to keep her in her own environment, either find an independent living or keep her at home with our family. because you live longer when you're, when you're taking care of yourself.
That's
and you're
right.
not in that, institutional setting.
That's right.
And it's wonderful that Green Spring has all of the options for
Right.
someone to choose from across the continuum of their life.
That's exactly right. Yeah.
So we're kind of having that conversation as to why we want her cared for at home. And, I'm the only nurse in the family. I'm the only healthcare person in my whole family. So everything kind of comes back to me, well, why would we do this? And so I had to give my family reasons why keeping her at home is a great option. And, the reasons that I gave are, people do tend to live longer. You can control your environment. If someone is sick, you can tell them, don't come today, don't visit me today. Whereas out in a different setting, you can't always control who's around you, who's coming to take care of you, who's coming, bringing, food to you.
Right.
So we can minimize some of those contacts that might, bring a cold to her that she'd have a harder time recovering from.
Well, the only thing about a person living at home, rather than a place like Green Spring and independent living, with some help perhaps, is that opportunities for entertainment,
Absolutely.
etc., are here. Dining service, getting to a dining room, that companionship of people their own age. To me, that is a big benefit. But
It is. And you guys having your own residence here, your own independent living apartments here, means you control that environment yourself, which is wonderful.
Absolutely.
It keeps people together, whether it's their small community that they've created for themselves of friends, or if it's spouses. And that's a huge part of healing too, is the people that you surround yourself with that help take care of you. And with home health and home support, we try to bring whatever family that we can into the care itself. So, when our physical therapists teach a home exercise program, we're not only teaching our patient, we're also teaching their family member, so that home exercise program can be done in our absence. So it brings it kind of elevates the care, in my opinion, where, yes, we may only come 3 times a week, but we're giving you the tools and your family the tools to keep up those exercises, not just while we're there during those 6 weeks or whatever, but after we leave. You have all the tools that you need to keep up that exercise, which is wonderful.
Do you field a lot of phone calls a day of people calling in, or is that relegated to a different individual in the department?
It just depends on what it is. My phone doesn't ring quite as much as it did when I was a clinical manager. So the clinical managers take a lot of the calls, and the home support schedulers they're basically on the phone all day long.
Sure. Oh, well, of course. Yeah.
But no, I generally don't get very many phone calls. We have really quality caregivers that care a lot about the people that they take care of. And I can see that in just the emails that they send, that they loop me in on when they're worried about something and they need to refer to the resident service coordinators or our medical center doctors. You really can read the concern in the emails themselves. So I think that care and concern lends to a higher quality of care, which leads to me not getting phone calls unless they're good ones.
Sure. So as the home care administrator, then what is your task? What is your job there?
My job is to supervise both lines of business and the management staff that supervises the clinicians on both lines of business.
Okay.
And then a lot of the financial work that's done, the reporting up to corporate, sort of giving them direction on both sides of home support and home health as to how the day-to-day operations are going to be managed.
Okay.
So I spend a lot of time reviewing reports, reviewing quality things, reading financial reports, going to a lot of the meetings on the ancillary committees and the resident committees.
Right.
There are different groups I go to.
So you're not really engaged much with the clients as much as you are with, say, the more administrative
Correct.
element, and also, then I guess when you say the ancillary, that you would be involved with residents then. on those committees.
Yes, and that's part of the reason that coming to Green Spring was so important for me. I love taking care of people. I always have, and although I have, ambition to be in administration, my heart is still in caregiving. And so being here and being able to walk down the hall and greet people and talk to people and go to the committee meetings still keeps me involved with people that are benefiting from our home health and home support services.
Yeah.
So it kind of gives me the best of both worlds to be
Yeah,
here.
it gives you the encouragement to continue.
Yes, ma'am.
I think they're very lucky to have you.
Thank you so much. I'm lucky to be here. This is a wonderful place.
Did you come here deliberately for the job, or did you knew about the job before you came back?
I actually got an email on my LinkedIn account one day asking me if I would be interested and if I was to send my resume, and I sent it, and all of a sudden I was having telephone interviews, and then I actually flew up here and met with Donna Epps and Chandra, and
Sure.
then went up to corporate and had like 6 interviews in one day before I had to fly back home. And I came up here. It's good to be home to the things that I know, but I came up here for this position. It's a wonderful opportunity.
Oh, that's great.
So.
So we're happy. So we've been chatting here. Are there things that the residents need to know that are new wrinkles down there? I mean, for me, a new wrinkle is this title of home care administrator.
Mm-hmm.
I personally, until this morning, had never heard of that title.
Right.
But that's my own ignorance, I'm sure. It's probably been around, but I just didn't know it. But tell me what else. What is the focus down there? And anyway, you're located in Forest View, right?
We are.
Yeah.
Downstairs across from the old hospice office, we have a whole resident life home health and home support office all in one space.
Right.
Wrinkles, I don't see any big changes. We're just growing, and our focus is on continuing to grow and making Green Spring the provider of choice for all of our residents here, because they can choose whoever they want. If they want to choose an outside home health or home support agency, they are more than welcome to. But I want to set us up to be the one that they actually choose, that they recommend to each other, and so that there is no competition, that we do such a good job and we have so much availability of our staff that we can meet everyone's needs. So we're just focusing on, hiring, retaining great staff, getting everybody, highly trained, and then thinking about some specialty trainings for different things that are coming down the pike. People are coming home sicker. The way insurance is going, they're being sent home from the hospital much earlier than they ever have been, so they need a lot more technical healthcare support at home.
I see.
So we need to train our staff to kind of keep up with that changing need.
I see.
So, but no other real big changes. Home support staff is going to be changing the shirts that they wear. They've been walking around with their green scrub tops, and they're now being given a different shirt, which is going to be rolling out soon. And
Okay.
hopefully, maybe next week I can bring those to show everybody on air so they know what they look like. There was some issues with getting them sent to us and getting the sizing right, but other than
Now
that,
you mentioned to me before we went on the air that you're going to be on again next week.
I am for home support.
You're here 5 weeks, and you're coming up, or in 6 weeks, and you'll be on Channel 6 3 times.
I am.
But you know what? I mean, you've certainly given me some information that I didn't have, and again, I cite it as my own ignorance, but that's a good thing that you came on here.
Thank you.
Now, is your grandmother here in this area, or is she back in Georgia?
She
Where?
actually is in New Jersey.
Oh, okay.
Near some.
Well, you're closer than you were in Georgia.
I am, and I already had to ask my family, are any of the Green Spring facilities nearby where you all live? Because, I mean, that would be a wonderful option for her, but they're a little too far away.
Oh,
but,
okay.
yeah, I grew up here. Most of my family is in New Jersey, and my mother retired to North Carolina about a year ago. So it's just me, and I have 2 kids that live here with me. So.
Oh, good.
Yeah.
Okay. How old are your children?
They are 4 and 7.
Wow.
Those are my babies.
Oh, now she even has a picture.
I do. I have a notebook with their picture on them. Those are my kids. I'm super proud. Yeah, I have a 4-year-old daughter and a 7-year-old son, and they're really excited to come back here. They've visited so many times with my mom, and I've walked around the campus just like walking to my car and stuff, and had them on FaceTime kind of showing them, you know, where I'm at, and they think that the pond where they do the sailing is the neatest thing ever.
Oh,
so they're like, when do we get to come see this place? So they're pretty excited.
Oh, that's terrific.
Yeah.
I think all in all, this has been a very enlightening interview, and I hope our residents have learned something as well. And you should bring the children when you're off duty. Just bring them over. Like, I never thought much of going back to work on a day when I'm off, but anyway,
yeah,
they can come. And
yep.
I don't know if they allow fishing in there or not.
I don't know, they're a little bit city kids. I'm not sure they would fit.
Okay. Thank you very much, Christine.
My pleasure. Thank you for having me.
Okay.